Okay, I love those CCS. Let's go. Now you have a 70-year-old white male who admitted to the hospital for resection of superficial bladder carcinoma through cystoscopy. Okay, let's see. Temperature is 103. Blood pressure is 90 over 60. Not not so good, right? Pulse is 110. Respiration is 18. He's okay. I'm gonna give you the whole history. Post-operatively, he had mild bleeding and had a Foley catheter for continuous bladder irrigation. Next day, nurse called you because the patient is having high-grade fever, chills, and became hypotensive. He's feeling nauseous. He denies cough, chest pain, shortness of breath, or headache. His other medical problems include degenerative joint disease, BPH, hearing loss. No drug allergies. He's not significant except Tylenol. He's not taking any medication, just Tylenol for pain. Preoperatively, labs, HB, white BC, BU, and creatinine, everything is fine. So, how do you approach this case? He's in the inpatient now.
So he already has IV access, I'm guessing. He's inpatient.
Yeah, let's do the things even if there is no IV access. Let's do the police
Police BS, yeah.
BS. Okay, oxygen, IV access, IV fluid,
Mhm.
cardiac
Cardiac monitor.
monitor. Okay, BP monitor.
Mhm.
Fingers. Take a good. Okay. So now, what do you want to do?
I'm gonna order all the stuff, the cut clean.
Let's do quick
Oh,
physical.
sorry.
Huh?
Yes. Physical, yeah.
Let's do genital because he had cystoscopy, extremities. Because could be endocarditis and stuff, so we'll see. This is just quick physical. Let's see, 8 minutes. Okay. So patient is having shaking chills, lungs are clear, abdomen is non-tender, bowel sounds are present.
Good.
There's no rigidity or rebound. Peripheral extremities are warm, so yeah, it looks like it's some septic shock or something. Let's see what we can do.
Mhm.
Okay, so what do you want to do now?
Well, let's do the cut clean. Let's order labs and see how they are. Let's see how the renal function is, LDH, all that
Yeah,
stuff.
I'm gonna give him normal saline bolus.
Didn't we give him IV fluids?
Yeah, but I'm gonna give him bolus, not just IV fluid, because. And then I'll discontinue the Foley catheter that he has. And let's do
Okay.
the cutagline, CBC, CMP,
Chest X-ray.
yeah,
Oh,
chest X-ray. Okay.
UA, urine culture.
Urine culture, blood culture. Yeah, the infection protocol. That's what I call it. I love like calling it.
Blood culture.
VT stool,
ESR, EKG.
ESR, EKG,
I want you to
PT,
do
PTT,
L LDH,
hmm
bleeding, PTPTR,
You said
tighten.
LDH? Yeah, I like this one. That's a good one. Bilirubin.
Bilirubin, good idea.
What else? Globin is not necessary now. Okay.
Now, you can do like, oh yeah, never mind. Yeah,
Let's give him. He's feverish.
give him
He's septic, huh?
give him Tylenol and give him Phenergan for nausea.
Yeah, he's having Tylenol. I'm gonna add Finnergan. Okay, he's having Tylenol, but I'm gonna write it because this is a new case. And then there is one thing very important. It's the
Hmm.
most important management we're still missing that we
Hold on.
should order at this
Just
time.
tell me. Give me a clue. Give me a clue.
So
Is it a
he's septic
antibiotic?
after a cystoscopy. Yeah. So let's give him
Uh,
ceftriaxone. Yeah,
Ceftriaxone.
that's the most important one here. Everything else it's nothing. Like, it's not gonna give you. It's not gonna treat what's going on.
Hmm.
Everything else is diagnostic, except this one is the one that treats. Because it's a cystoscopy. You know what I mean? What bacteria are you thinking of?
I'm thinking of E. coli.
Enterococci, E. coli. Yes, could be them. Cystoscopy could be enterococci, E. coli. These types of things. Now, stool. I think we don't want to waste time
I don't
for
think
that.
so.
We
No,
don't
no,
need
no.
it. Yeah, we don't need it.
No, I think it's a UTI that caused it, like a really bad urosepsis or something. Because if he had a bladder surgery and he has a Foley catheter, it
Nah,
can definitely call urosepsis.
I think so too. You're right. Yeah.
Enterococcus. So I think ceftriaxone should cover the bacteria.
Yeah. What's going on here? We don't need it. Finnegan.
I hope the CCS cases are not complicated, like, oh, they're allergic to this, allergic to that.
Yeah, yeah, you're right. Yeah.
And then it's like you have to stop and actually think.
That's true. Yeah, that's true. You're gonna. But this guy, is septic, so I'm gonna send him to the ICU.
I would have sent him to ICU from the beginning, but
No,
then
no.
I didn't.
So I did not send him. He was already in the inpatient. I did not
Ah,
change his location. The presentation this was inpatient, like started,
got
like
it.
in the beginning. We got it. So now I'm shifting into the ICU.
So then we do the ICU
Let's
mnemonic.
Yeah. Let's just do. Okay. What is the ICU
I
mnemonic?
want to urine culture, please.
Okay. Yeah. Yeah. So now the white BC count is 13,000. White
Mm-hmm.
BC, positive nitrate, positive esterase,
Oh,
many
see,
bacteria, BMP. Okay, so that's a UTI, as you said. Your guess was right. So now let's do the
can we
ICU. What is it? What is it? You said the ICU mnemonic. What is it?
we panic?
Oh yeah, the same admitting guard. Okay, V panic vitals.
Vitals,
Mm,
omeprazole,
omeprazole. Okay.
activity like bed rest,
Bed
no
rest.
bathroom
Yeah.
charges, N for NPO.
NPU. Yeah.
These are, I for input output,
Input output.
pneumatic compression.
Take
Did you take his Foley out?
huh?
Did you take his Foley out?
Yeah, yeah. Discontinued his folio. And then
Oh,
there is one thing I wanna do. I wanna give the CBC BMP. I wanna put it every 4 hours, and then I wanna do the pulse ox every 4 hours too.
wait, Mo, why? How are you going to manage his input output if we took his catheter out?
No, you just monitor his output and input.
How?
Yeah. Huh?
How if we took his catheter out?
Yeah, maybe they put it back. I don't know. They give him a new one.
I would put a diaper on him.
Yeah. Yeah, that's funny. So omeprazole. I think pantoprazole. You give it
Pantoprazole, yes.
should be
Penta
pantoprazole so that it would be IV, right? Yeah.
yes, pantoprazole.
Yeah. Okay. CBC, let's do it every 4 hours. Like any infection, you would want to monitor like every four.
And yeah. Did his kidney functions came back? BU and creatinine, were they elevated?
No, they were fine.
Okay, good.
Pulse ox every 2 hours.
Sure.
Yeah, I like this monitoring stuff. What is
Yeah,
the omeprazole? Let me give him pantoprazole.
pantoprazole, yeah. Are you good at biostats?
Yeah,
Really?
yeah, I'm really good at it.
Can you review biostats with me?
Yeah, I can do that.
Basic biostats, that's for step 3.
Yeah, yeah, I can do that. And yeah, I can do that. So now let's just advance the clock and see what is he doing. Okay, so blood pressure is getting a little bit better. Fever is getting down a little bit. Like after 6 hours or so. So now I'm gonna advance it for more hours and see. So after 3 hours, I'm just gonna check on him really quick. Yeah, he's feeling a little bit better.
Good.
Okay.
I should keep him in. We should keep him in ICU for observation for at least 2 days because he's septic.
Yeah. Let's see. Advance it to the second day.
I like our mnemonics. I'm so used to it now.
Yeah, me too.
BS and cut
Yeah.
panic. I think it covers majority of it.
Yeah, that's true. So that you don't have to remember so many things. You just remember that one.
Yep.
That's different. Like for example, serum osmolarity or for DKA specifically.
Mm-hmm.
If you order
Mm-hmm.
that medication for that condition, that sort of thing.
Yeah.
Okay, so this is what's going on here. He's getting better. So I'm just
Mm-hmm.
gonna shift him to the inpatient unit right now.
Mm-hmm.
Confirm move. Okay.
Mm-hmm.
Now I don't need the some of the stuff, so I want to discontinue some of the stuff. What are they? Do you want to tell me about it?
Yeah, the promethazine, the I mean not promethazine, the pramiprazole.
Yeah, saline. I don't need it anymore. Pantoprazole. I don't need it. Even ceftriaxone. I don't need it.
If he's fever free. Acetaminophen you can discontinue if he's
Mm,
fever. You can discontinue the fluids, right? Is he back to normal?
yeah, I discontinued the fluid. Yeah, he's back to normal.
But I wouldn't keep him NPO. Give him regular diet.
Yeah, that's a good one. I'm gonna give him. So this is what I'm gonna give him diet. I'm gonna give him Bactrim instead of the ceftriaxone, and I wanna do urine culture again and blood culture just to
Yeah, just make sure it went down.
and do urine analysis just to.
Did
Hmm.
blood culture show anything, or was it negative?
They didn't mention here.
Oh,
Yeah.
that's weird. You ordered it though.
Yeah. So the Bactrim, just give him oral.
Mm-hmm.
Do urine culture again, then blood culture. Urine analysis. Okay. Cardiac monitor. Do I need the cardiac monitor now?
Um, why not? It's not gonna harm him. Leave it on.
Yeah, I can leave it on. Okay.
Mm-hmm.
Yeah. So this is a nice case of urosepsis. Now I'll just see him another day. I think he should be fine.
Mm-hmm.
He has a bladder cancer, so
Yeah, probably a smoker.
yeah.
This is interesting. We got a case, somebody who was already inpatient, and we had to manage him acutely. That was awesome.
Yeah, that's a new one.
Yeah. I was thinking about you before you texted me.
Oh, that's so sweet. What is it? What are you thinking about me?
No, because I was should I text you? Should because my husband took my daughter out in the park.
Yeah.
So she's not with me right now. So and it's a Saturday and there's no daycare. So he's like, oh, I'm gonna take her, to go out in the park. I said, okay, I'll study. And I was studying. I was revising my notes. I'm like, should I text him? Should I do C? And then it was funny you texted me. That's why I responded so quickly.
That's good. Yeah, I'm glad. Yeah.
Yeah.
So you saw I discontinued the BMP every 4 hours, CBC, CMP every 4 hours, and the
Yeah.
pulse ox every 2 hours. We don't need that anymore. Okay.
No.
So I think that now should be fine. Let's just you want to do counseling and
Yeah.
he's
Just
he's a 70 years old, so you want to do some of the stuff. Let's do counseling.
he's
Reassurance.
old. 70?
Vaccine, huh? Yeah. Colonoscopy.
And so pneumococcal vaccine, the other vaccine, colonoscopy.
The thing with these vaccines, I want to do them in the 2 minute screen because I don't want to do them now. I
Oh,
wanna.
we're not in 2 minutes. Okay. Yeah, don't do that. Do that.
Yeah, yeah. So I'm just gonna.
So just counsel. Yeah, just like regular, no smoking, no drinking, whatever, education.
Yeah, yeah. Exercise program. Is your parents here?
Yes.
Do they go to the gym?
Why? Yeah, they do.
They do.
Yeah,
Oh,
that's
that's cool. I'm begging my parents to go to the gym and they never do.
my parents work out every.
Huh?
My husband is a trainer for the gym.
Oh, that's cool.
He does that as a side, as a hobby, as a side job because he's very like health conscious and
Oh,
he eats like very good diet. So he tells everybody in the family, he educates everyone. So he put everybody into gym except me.
wow.
I'm the only one who
Yeah, you know this US family crazy. Like they don't don't give us time for gym or nothing. Yeah.
he bought me a treadmill as a birthday present. I'm like, what are you gonna
Ah,
do to me?
that's
He's like,
funny.
I want you to.
Yeah, but I'm glad it's gonna be done soon. Okay, so this patient, how do you summarize this case for me?
Oh, so we have an elderly who's already inpatient and who kind of got what do you call deteriorated in the inpatient, and the cause of this well from his vitals, like he's hypotensive, tachycardic, fever. So we have to rule out all sources of back of what do you call infection. So we had to do blood cultures and urine cultures, and especially if this patient had a bladder surgery and he's on urine catheter, we have to rule that out. And once his results come back positive for sepsis, we start away. We start him on ceftriaxone and do like the basic management, stabilizing like IV fluids, and take care of his fever and pain and nausea, and then we shift him once he's stabilized. We shift him into I mean he's already in ICU, right?
Yeah.
So we kind of do the whole ICU mnemonic, the panic, V panic, um, and then yeah, basically. And then once he's getting better, we put him back into inpatient. We also start him on Bactrim, and we cancel all the other ones. It's like a basic, yeah, sepsis management. So the key things is to make sure order blood culture, urine culture. Key thing another is make sure you give him ceftriaxone. And the next thing is when you put him back into inpatient, you change it to Bactrim, and then you repeat cultures to make sure that the WBCs went down. Why are you doing CT scan?
That's a good idea.
For what?
Yeah, because he's a smoker and I want to do it like for lung cancer. What do you think?
Yeah, why not?
CT scan of the chest?
We could do AAA screening on him.
Yeah, we should do that. Oh, this one. Yeah, I think we should do that. You know, there is something very tricky. Like, I don't know, for some reason we always forget it. Like, the screening for guidelines for lung cancer. Do you know them? You remember?
Yes, so they have to be a smoker and they have to be above 65. Now, if they quit smoking 15 years or more, then it's not indicated.
Yeah, but at what age? To what age?
65 to 75? I don't know.
No, I think it's 55 to
Oh,
85.
oh, 55. Sorry, yeah, 55. 65 is for AAA. 55 to. I just revised these this morning.
Yeah,
Yeah.
this thing, yeah, was crazy. One time I had a guy with a 59. So I got confused there. I thought it's 65.
Oh,
But
right.
you gotta give him screening too. But
Yeah, let me double check. Hold on. One,
yeah, so as you said, when you have someone inpatient with fever, so what do you suspect with the most common cause of nosocomial infections, nosocomial fever?
most common cause,
Yeah,
UTI,
UTI. How about the second most common cause of?
pneumonia,
No, SSI, surgical site infection.
ulcer,
Yeah. And the third, how about the third most common? It's the
Pneumonia.
pneumonia. Is it coming?
Yeah.
Okay, so that's the most common. It's pneumonia. Okay, that's the most common. Do you mind if I just be back in 5 minutes while I revise this thing? Less than 5 minutes, huh?
Okay.
Like 3 minutes. Okay, I'll be back. Just a sec. Okay, this 45 white female presented to the office with fatigue and exertional shortness of breath for the past 2 months.
2 months. Hmm.
Yeah. Temperature 36, blood pressure 120 over 76, pulse is 80, respiration 14. Okay, the symptoms are getting worse. She denies chest pain, orthopnea, paroxysmal nocturnal dyspnea, or leg swelling, palpitation, syncope, weight loss. So she doesn't have that symptoms. She has not looked at her stools for melena, but she denies any blood in the stool. The only problem is some epigastric discomfort, for which she takes over-the-counter antacids. She takes no medication, menstrual cycle are always regular. She smokes one pack of cigarettes for the past 20 years. Occasionally, she drinks alcohol and does not use recreational drug. Her sister has asthma, otherwise her family is not history not significant. Last pap smear was normal. Okay, pelvic exam, breast exam is fine. Review of system is negative. So okay. So how do you work up this girl who have
Let's do a full physical.
shortness, fatigue, exertional dyspnea? So what's your differential?
I don't know,
It's
hypothyroidism.
very broad, yeah. So let's do physical.
Yeah, or like anemia,
Yeah,
or I don't know. We'll have to order tests.
yeah, and we'll do general physical. Now, pallor, that she has pallor. Abdomen is very mild discomfort to deep palpation in the epigastric region. Everything else is fine. So what do you want to do? She's in the office right now.
Let's do cut green.
Okay, CBC, CMP, chest X-ray.
UA.
Okay. Lipid panel, alpha BT, TSH. Is the stool, okay, UA. What else? ESR.
You did PSH?
Yeah, yeah. And then let's order ANA, and then what else? PT, PTT, INR, leading time. What else?
Iron studies.
Type, yeah, iron, that's a good one. Mm.
Iron studies. What else? What else? Can we do yeah, LFTs and
My legs. Yeah.
lipase? Yeah, all of that good stuff.
No, no, okay. Yeah, I did the CMP, so this is gonna show us the LFT. PA lateral, let's do that. What else do you want to do for the stool?
Did you do FOBT?
Yeah.
That's it. Nothing crazy. She's not having diarrhea.
Yeah. Just in case she has any. Do you know, like, I think Selena Gomez?
Yeah, what about her?
I think she had SLE.
Mm-hmm. Yep.
You know that? That's
I found it was a couple of years ago.
really. I don't know. I just knew that today. Feel bad,
Mm-hmm.
like these like conditions is crazy. Like,
It's
there's
autoimmune.
yeah, this crazy like steroid, and steroid has a bunch of side effects and stuff.
Yeah, and she's so pretty.
Yeah. Okay, so now you want to get some results for a little bit.
Please.
Yeah, let's get some results. So okay, so occult blood is positive.
Oh.
Okay. CBC is 8.
Oh, there we go.
MCV 72. ITBC
Iron,
6000.
iron deficiency.
Peripheral smear shows hypochromic microcytic anemia, BMP. Creatinine
Mm-hmm.
1.1. Chest X-ray is normal. Everything else is fine. Okay, so now we think the most likely cause of shortness of breath is anemia. Right? Okay, so and due to GI bleed, especially when she has epigastric discomfort.
Mm-hmm. Is she on NSAID?
No, no, she's not. So what do you
Oh,
want to do now?
give her iron supplement.
Let's admit her. Her hemoglobin is 8. It's very scary, right?
Oh, hemoglobin is 8. I'm sorry. Yeah.
Let's admit her to the floor. Do you get like if you when you eat and then you lay back, do you get some not burning like disburging in your epigastric area or something like that?
Yeah. Why?
Huh?
Yeah.
Yeah, you get that. I don't know. I've been getting this thing. I think I should stay some time. I should not go lay back. Should not sleep. Like should not eat and sleep right after.
See, what happens with me is when I get anxious.
Okay, so now we admitted the patient. So what do you want
Mhm.
to do? Let's do the V panic.
Yeah, I would do the V panic.
Vitals. Okay, what else? IV access, AV fluid, cardiac monitor, BP monitor. Well, what else?
BS. Finger glucose, I guess, if you want. Do PTT, PT, PTT, INR,
Yeah,
cross
I
match.
did those. Yeah, I did those. What else?
When did you do? Oh, you did it before?
Yeah, I did in the beginning. Yeah.
Oh.
V panic, bed rest, NPO, input output, and
Hmm.
pneumatic compression. This is we combine the police
Yeah.
BS and the V panic.
Yes.
Police BS, yeah, and V panic. We did that. Okay. So now let's do. I did the ferritin. I think I did not do it.
Yeah, ferritin, TIBC. Well,
I think I should order the hemoglobin, hematocrit level like every 4 hours or so. Just see.
I'm just wondering what can cause the GI bleed in her. Like, she doesn't have any. She's not even on NSAIDs. Does she have any history of any GI disorder?
No, no, that's what we're gonna find out. Hopefully.
That's too much bleeding.
Yeah. Hemoglobin, hematocrit, CBC, CMP. Let's keep those running in the background every 4 hours. Okay.
So she's inpatient. Besides giving her fluids and monitoring her, did we give her anything? Any other meds?
Let's give her omeprazole because she's having bleeding, right? That's it.
From the other one, the P one.
We can't even give her this one or the other one. Doesn't matter really. But we can give her that. Yeah, because she's on IV. Yeah. Okay. What else? She has constant bleeding. So do you want to transfuse her?
I mean, at 8, the recommendations we say 7, but I don't know.
Yeah. Let's give her fresh frozen. Like let's give her red blood cell transfusion, huh? Because
Okay.
she has constant bleeding.
I want to do abdominal X-ray or CT to see where is the bleeding coming from.
Yeah. I'm gonna need endoscopy too.
Endoscopy, yeah.
So, you said abdominal X-ray.
To rule out any perforated ulcer.
Yeah, yeah, you're right. Yeah. Let's see. I'm gonna do endoscopy like after 10 hours or so.
Well, you cannot find RBCs.
Transfuse packed RBC. So I'm just looking for it. Let me see. Transfusion.
It's right there. Pack RBCs right there. Yeah.
Yeah. No, I'm just gonna advance it for a couple of hours, 6 hours or so. Once I get her a little bit stabilized, and then I'll do endoscopy. Yeah, her hematocrit is getting better. Everything else is fine. Labs are fine. She has iron deficiency anemia. So what do you want to do now?
I don't know. Monitor her H&H.
Let's do the post procedure for endoscopy. Let's take consent. You remember it's called NBC pipette.
What's that?
The the NPN for NPO and the BC for consent, and you can do chest X-ray. I don't know, I forgot. And then you give her. So this is for any procedure if you want to do it, and PTT, INR. Okay, that's we did that already. So we're just gonna take consent for procedure right now.
Wait, you have to consent for endoscopy?
No, so there's always like there's always a debate about it, like whether you have to take consent or not for upper GI endoscopy. So some
Hmm.
say that it's good to do consent for a procedure. Some they say it's okay. So now I think if you just take consent before like procedures, that would be maybe it will add a bonus for you.
Okay.
So let's do flexible GI with the endoscopy, and let's test for H. pylori. What do you think?
Good idea. But endoscopy should tell us that.
Yeah,
You can do a. Are you gonna do the urea breath or are you gonna do stool antigen?
we can do the serology antibody.
Oh, even better.
Yeah.
Sounds good.
Okay, let's see the results. Okay, endoscopy shows clean base non-healing duodenal ulcer and H. pylori is positive.
Oh, there we go.
So what do you want to do now?
Give her the triple management.
Clarithromycin?
Erythromycin, amoxicillin, metronidazole. Or
No, that's the third one is pantoprazole. She's already taking that.
oh, sorry, yeah.
Okay, I give her iron. That's a good one.
Uh-huh.
Okay, what else? Let's give her vitamin C. That will gonna accelerate healing and iron-rich diet. After let me cancel NPO first. What
I think that.
else? And then I'll cancel no NSAID.
Hmm.
No aspirin. No non-steroidal. Wow, they repeat the same things. I think because people sometimes write different stuff so that it will show up if you write
Mm-hmm.
any stuff. That's why they had the options multiple times.
Yeah, it's
Okay.
because everybody can type in anything differently. I think that they just have the same thing in 10 different ways.
Yeah, I think so. Let's give her diet rich in iron. High iron diet.
Mhm.
Let's give her high fiber.
So the key thing here was for diagnosis was endoscopy.
Yeah.
And it's good that you transfused blood in her.
Yeah, because she has constant bleeding. So
Mhm.
now I'm just gonna keep her for until the second day. I'll examine her and then I'll just send her home.
Mhm.
Follow up in 2 weeks. That's
Mhm.
okay. I'm gonna just examine her really quick. How's she doing? Okay, she's feeling better and everything's going well. She's a 45. Yeah, any screening? Nah, not much. Let's just send her home.
Lipids, that's it. Pap smear.
Yeah, she already done pap smear and stuff, so let's just send her home. I'll follow up with her in 2 weeks.
Yeah.
Okay. No, I think we did everything. So
Mhm.
that's good, yeah. So how would you summarize this case for me?
So, anybody who comes in with fatigue for a very long time, or has pallor on the physical exam, our differential should definitely be anemia, and therefore we'll order like CBC and basic studies to see the hematocrit and hemoglobin. And in this case, if the hemoglobin is really low and she's having shortness of breath, which means that's a sign that she's actively bleeding, and we should also consider transfusion. We should like send her to the ER or inpatient and transfuse her. And then once she's stabilized with transfusion and her symptoms are resolved, we would do an endoscopy and we'll see what's causing the bleed. And we'll find out that it's H. pylori. And once we find out it's H. pylori, we kind of treat her for H. pylori triple regimen. So we'll already have put her on the PPI. So we just add two more antibiotics. Um, we can add amoxicillin and clarithromycin, right?
Yeah.
And then we just monitor her closely with her H and H, and kind of like keep her for a couple of days until her hemoglobin comes back to normal, and call her back after a couple of weeks.
Yeah, and
And
yeah, and
also do this too. We do the H. pylori serum testing, so that's like double confirmation.
that's true. Yeah, and then you can order urea breath test like for later in the 2 minute screen for in 4 weeks.
Okay, yeah, just to see.
Yeah, it's not
No,
important, but you can just do
wait,
that.
no, not urea breath test. You want to order a stool antigen test, which is going to tell you the prognosis of her H. pylori if it's eradicating.
Yeah, yeah, confirm eradication. Yeah. So what is the most cost-effective test to identify H. pylori?
Stool antigen.
Is the serum serology?
Oh, that's the most really okay.
That's the most suspect. Okay. Okay, so you want to do another one?
Yes.
Okay, let's go. How many left? Like, there's so little, I think. I don't know. Okay, let's see.
Four.
Okay, let's go. We're gonna destroy the CCS.
I
Okay.
mean, okay, if we can't finish today, I can still do it tomorrow or Monday.
Yeah, yeah, yeah. We're gonna maybe we can do one more and then we can finish it tomorrow.
Yeah.
Okay, now in the emergency room, you had a 64-year-old man with shortness of breath.
Mhm.
Blood pressure is 140 over 85. Pulse is 87. Respiratory rate is 22.
Mhm.
Okay, let's see. Oh, that's right. Okay. Now, this guy having 2 months of increasing shortness of breath condition is worsened over the last 2 days and now has shortness of breath at rest.
Oh.
Yeah, he's slightly relieved when he sits upright, his mild cough with deep inspiration.
Mhm.
He has occasional pink frothy sputum, weight gain over 6 months,
Mhm.
easy fatigability, leg swelling, decreased appetite, no fever, no vomiting, no headache. Bowel movement are regular. He has no urinary problem. He reported that his diet has consisted of mostly of canned food since his wife passed away 9 months ago.
Mhm.
Past medical history of hypertension, type 2 diabetes, you name it. MI, 6 years ago. Treated with thrombolytic therapy, hypercholesterolemia. Medication, you name it. Metoprolol, lisinopril, gluperide, simvastatin, aspirin, isosorbate dinitrate. He's compliant. He doesn't have allergies. He smoked 1 pack of cigarettes, so you gotta counsel him a day. For the past 4 years, you gotta counsel him. He drinks alcohol on weekends. He's retired, lives alone.
Mhm.
Okay. How do you approach this case now?
We're gonna do a full physical.
No, so he's in the emergency room.
Wait, he came to ED or the office?
No, in the emergency room.
Oh, sorry.
What do you want to do now?
So I'm gonna do a focus physical and then do our police.
So
Yeah.
before that, let's just put the ER orders. He's in not a good condition. Let's do pulse ox,
Okay, police BS, right?
oxygen, IV excess, IV fluid, police. Okay, cardiac monitor, BP monitor, and then finger stick glucose, and then elevate head of the bed. This for these guys.
Coughing and stuff.
No, because he's having congestive heart failure.
Mm-hmm.
This is EKG.
Let's do an echo on him too.
Now let's do a quick physical.
No, his lungs.
Yeah, I think that should be enough. Maybe abdomen. That's it. While the orders are running at the same time. Oh, I should have added CBC and BMP. For any emergency order, that's I'd love to add like CBC BMP. That's very helpful to add.
It is, yeah.
Yeah.
It's okay.
Because by the same time you finish physical, you have the CBC BMP.
That's true.
Yeah, so that's you always make the habit of doing that. Okay, so now he's a 64. He appears in his stated age, mild respiratory distress, JVD, moderate JVD, bilateral decrease of breath sound with a crackle. So you get what's going on, right?
Yep, he's having congestive heart.
Abdomen, soft right upper quadrant tenderness. Liver is 1 cm below costal margin. Extremity is 3 plus bilateral pitting edema.
Mm-hmm.
So it's differential diagnosis.
Congestive heart failure. With symptomatic pulmonary edema.
Could be decompensated heart failure. It could be obstructive lung disease, interstitial lung disease, cardiomyopathy. Okay.
Okay.
So now let's do the stuff that we want. CBC, CMP, cardiac enzymes, lipid profile, FT, FOBT, TSH, it's not that important. ESR, BNP, magnesium, phosphorus. What else? See urinalysis. Chest X-ray. What else? Let's do troponin.
Yeah, cardiac
Let's give
and
him furosemide. What do you think?
furosemide. Yeah, because he's having shortness of breath.
What else? Anything else?
Mm-mm.
CBC.
Did we do chest X-ray?
Yeah.
Oh, okay.
Yeah. So CBC,
Yeah,
LFTS.
you did the cut clean. That's it. Yeah.
Yeah, I did CBC, LFTS, ICU, PACS. Yeah, that's about it. We did maybe PT, PTT, or order it later.
You want to master this exam with all the practice you're doing with all the students.
Yeah.
Like you want to score perfect, don't you?
Yeah, it's not just that. Like, I wanna create videos because, like, when I watch these videos of Dr. Najib and stuff, it was made my life much easier. So I wanna make videos and I wanna give them to other students, create a course, legit course out of it. Yeah,
Are you
because
gonna charge students, or are you gonna do it for free?
help other people. Yeah, I may charge like some simple. I'll make it a very reasonable price. I'm not gonna be too much expensive or something like that. Yeah, I wanna like create a product that can help other people. So it will be memorable. Yeah. So because my life purpose is to make an impact on people's lives, so that's the beginning that I want to do. I think I can make an impact through those videos. Yeah, and after that, I want to do like something bigger. But that's the first thing that I want to do.
Alright, keep me posted if you become something big.
Yeah, of
Like,
course.
then I can be like, I know this guy.
Yeah, you too. Maybe you will be something big more than I like sooner before I do. Yeah, so let me know too. Okay, so let's see the things here. Like you have chest X-ray. There is a bilateral pulmonary edema. Troponin is normal. Na is 138. Blood glucose is 380. BNP, yeah, BNP is 1800.
Can we give him regular insulin?
Yeah, let's admit him first, because this guy is obviously he needs some intensive care. Let's do vitals. Pantoprazole. Maybe we did that. V panic bed rest. NPO input output.
Did you do an echocardiogram?
Yeah, I'm gonna order echo now. Okay, pneumatic compression. Let's do PTT, INR.
You know the mnemonic LMNOP for CHF?
Yeah. You wanna do that?
Yeah, we give Lasix, M morphine, N nitrate, O oxygen, E for positioning. So we already elevated his bed, right? So that's good.
Yeah, what else? Let's do telemetry. Let's do fluid restriction. What else? Let's measure his weight. That's an important one too.
Yeah. Can I ask you a question, or should I wait for it later?
Yeah, sure. Go ahead.
So if in this case his sodium was normal, right? But let's suppose if his sodium was low, let's say it was like 119, how would you change your management in that case?
Yeah, so if the sodium, 119, this is mild hyponatremia. So you just restrict fluid.
Just restrict fluid.
Yeah, but if it was like 110 and he's having some complication out of it, like drowsiness or seizure and stuff, this is severe hyponatremia. Then you give him hypertonic fluid.
Like the 3%?
Yeah, if it was like 110, 108, this is severe hyponatremia.
So even though he's CHF, he's already volume overloaded.
Yeah, but if he's only if he's having complication of hyponatremia, like if they're having if
Oh.
having a seizure
So,
or something.
so how do you know if it's complication versus dilutional hyponatremia
From the symptoms.
from the symptoms? So if
Yeah.
he's asymptomatic,
Yeah.
then it's probably dilutional.
Yeah, so that's what but his hyponatremia is 138, so it's still fine. Like, it's very,
No, no, I know. I was
yeah.
just changing the case. I said, what if they gave me a hyponatremia? Then how would I?
Yeah, then it depends on the symptoms. Like if it's 110 and with seizure, then you gotta address that. That's more serious than congestive heart failure. Okay, let's do NPO. I don't think he needs to be an NPO. I'm gonna change that. This is a echocardiogram. The compression, PTI, morphine. Give him IV. But you know, that's the thing. He's already taking these medications. But it's okay. I'm just gonna do them for the practice.
Okay.
Yeah. Maybe I switch them. Oxygen therapy. Weight. We can do it every day. Daily weight.
Mm-hmm.
What else? Now he's having. Okay, let me give him diet. What type of diet do you want to give him?
Low sodium,
Okay,
low
what?
salt. I don't know. That's the only one I can think.
Yeah, low sodium. Mm, diabetic diet.
Did you give him insulin or no?
Yeah, I'm gonna give him insulin. I was about to ask you this question after the diet. So low fat too. I wanna give him low cholesterol. That's okay. I'm gonna give him now. He's yeah. You're right. That's a very good one for his hyperglycemia. Okay. So I'm gonna do a quick check. I'm gonna give him insulin. Like I can give him Lovenox.
Yeah, you don't want to throw him into HHS.
Yeah. So what else? Now give him potassium because he's taking furosemide. Any furosemide, give him potassium. What else do you want to do? I'm gonna do
Okay.
BMP like every day or so.
Sure.
CMP. I'm gonna do HbA1c. Okay. Yeah. Anything else?
No.
I'm gonna give him insulin sliding scale. Let me see.
Is that an option?
I'm gonna see. I'm gonna try and find something like that. So subcutaneous. Give him KCL. Yeah. Give him oral potassium. That's okay.
Yeah.
Okay. That's already insulin sliding scale. It's not an option. Let's see.
Or just give him regular insulin.
Yeah, I'm just gonna give it regular. Yeah. I'm gonna do HbA1. Now let's just advance the clock for a little bit. So you see that's good. We did everything like in 20 minutes of simulated time, which is really cool. So now he's he's feeling much better after the furosemide.
Yeah. Good.
Because the fluid was causing the issue. You know that's why your husband gave you a gift of treadmill. So you see.
So I don't die of CHS?
Yeah.
Yeah, I guess he loves me indirectly.
Yeah, that's true. Yeah. It's the best gift ever. Okay, so now what do you want to do? Let's just examine him like after 4 hours. Just quick physical.
Okay.
Yeah, patient feeling better and stuff like that.
Mhm.
Let's get the echo results. So the echo shows moderate left ventricular hypertrophy, left ejection fraction of 40% abnormal.
Okay, so it's preserved.
Okay, yeah. So now let's just see him next day. So that was CHF exacerbation, so that's like...
Yeah. So first thing first, you have to manage this patient symptomatic so shortness of breath by giving him furosemide. That would definitely help him.
Yeah.
And then we have to rule out MI, always a cause. Once we rule out MI, what cardiac enzymes, EKG, then we manage the CHF.
Cool, yeah. So what do you want to do now at this point?
Where is he now? Is he still inpatient?
Yeah.
Okay. So just monitor him.
Let's discontinue IV furosemide, give him oral furosemide. Let's do pulse ox. We ordered it into every 2 hours, right? Should be coming up. Why is not here? Come on, order it again. That's okay. Because that's determined. Like that's our job is just to determine the dyspnea that he's having, shortness of breath. If he's feeling better, then he's ready for discharge. Yeah. I suppose he still need another day. Okay, so I'm just gonna advance it for another day.
Yeah, I think you should. Oh, we have a minute left.
Yeah. Now he's feeling better. Okay, so I'm just gonna discharge him home. Schedule an appointment. See him next week.
Counsel him?
Yeah, I'm gonna send counseling too.
Fluid restriction, daily weight checks.
Yeah. That's true. Counseling. Ouch. Okay. So education. Reassurance. This I'm gonna recommend cardiac rehab program.
Good, yeah, that's a good call.
What else? That's about it. Let's see.
So on 2 minute screen, we can do his follow-ups.
Mm.
And routine stuff.
Now just follow up in 2 weeks. So how would you summarize?
Yeah, basically, yeah, I was saying earlier, like, anybody who comes like in this with his age and everything, shortness of breath, any kind of, this guy didn't have chest pain, but first thing first, you have to rule out MI, you order cardiac enzymes, chest X-ray and all that, and then you also once you rule out MI, then you treat his symptoms first, like he has shortness of breath, and then you give him furosemide once you find out he has crackles and JVD, signs of like heart failure. And then once you treat him symptomatically, we order all of his CHF diagnosis, such as echocardiogram. You can also order BNP. You can also kind of order chest X-ray, and all of that to see the edema and all that, right? Right?
Yeah, right, right.
Okay. And then once his symptoms are okay, we kind of do the LMNOP, initially. And once the LMNOP is done, you stabilize him, you see the echo, what's going on, and then you kind of. Did we give him anything for antibiotics? No, right?
No, no.
He doesn't need anything. He just needs furosemide. You add potassium. You check his glucose. Glucose is high. You give insulin. All symptomatic. Like treat all the symptoms. And then
When do you order non-invasive positive pressure ventilation?
non-invasive positive. I think when his respiratory when he's in respiratory distress.
Yeah, if you give him, so first you give him IV furosemide, and then you give supplemental oxygen. If the oxygen didn't improve, then you order non-invasive positive pressure ventilation. Okay, how about if someone refractory systolic heart failure?
Refractory systolic heart failure?
You give him temporary IV dopamine and milrinone.
Oh, okay.
Okay, so what decreases mortality, chronic systolic heart failure?
You can give them the drugs.
Which one?
Heart failure drugs. Beta blocker?
Yeah, three things. AC inhibitor, ERP, number one. Second thing, a beta blocker. Third one, mineralocorticoid receptor antagonist, which is spironolactone, I think eplerenone too.
Yeah.
Okay. So continuing, these medication in acute HF depend on whether the patient is taking these medication prior to presentation, and depend on the hemodynamic status in decompensated state. So those are the medication. Yeah. So as you said, like the summary of this case, you summarize it very nicely. That someone who presented with shortness of breath, crackles on physical. So obviously from the history you can tell it's a CHF exacerbation, dyspnea, orthopnea, PND, paroxysmal nocturnal dyspnea. You do the elevate the head, you do police BS, and then you do examine him. After you examine him, you order that cataglin or CBC, LFTUS, ICU packs. Okay, and then you admit him. Then you order the V-panic plus the insulin with potassium, and you give him furosemide, Equicheck, give him Livonox, put him on a sliding scale, and you order echo for anyone with CHF, and recommend diet, low salt, low cholesterol, diabetic diet, and restrict him from fluid, because fluid is causing the problem here. And then once he's stabilized, convert, like second day, convert IV to oral diuretics.
Yes.
Okay, and determine the dyspnea, monitor oxygen every 2 hours. Once oxygen is getting better, then you can discharge him, educate him, cardiac rehab, counsel him of smoking. Okay, that's about it for this case. Okay, the case before that, it was
Wait. Can we do one more or no?
What is it?
Can we do one more?
Let me see.
Can we do like a quick, like a pancreatitis? Remember I told you I wanted to do pancreatitis. You didn't cover that yet.
Yeah, let me see. I don't know why did it come up yet. It's in the practice cases. Right? Let me see. Okay, so the case before that, it was like a girl who had a bleeding and epigastric pain. When we did the FOBT and the cataglin, we found the blood in the stool.
Yeah.
So we admitted her, we did the V-panic, okay, and we transfused her RBC because she has constant bleeding. And then we do endoscopy. Once you find H. pylori, you order the triple therapy, give her clarithromycin, amoxicillin, and iron, vitamin C, and should be fine, should be good to go.
Yep.
Okay. Now the first case we did, this was for a 7-year-old white guy who had a cystoscopy. Caused him to have sepsis. So first thing you do the police BS.
Yeah.
You examine him quickly, and then you do the V-panic, discontinue Foley catheter, and then you order cataglin.
Right.
Yeah, he's already in panic, and you add ceftriaxone. That's the mainstay of treatment. See, so ceftriaxone. That's the mainstay of treatment. And then you give him Tylenol, pneumatic compression, and those cool stuff. And then once he's stable, just discontinue IV normal saline cardiac monitors, ceftriaxone. You check urine and blood culture next day, and CBC next day. Any infection, you would want to keep the CBC, BMP running in the background, vitals, pulse ox, keep them running every 4 hours or so. Till once he gets stabilized, just discharge him, and and change the medication from IV ceftriaxone to oral Bactrim, and he should be good to go. Just follow up with him next week.
Which guy was this?
The guy who had a sepsis after
Oh,
cystoscopy.
right, right. Okay.
Yeah, urosepsis. Okay, so now this is the end of this lecture. Do you have any questions, concerns?
No, I'm good. Thank you.
Cool, cool, that's good.